Welcome to 10-Minute Health Tech, the AI-powered podcast where we dive into healthcare technologies and companies so you don't have to. I'm Anthony.
And I'm Julia.
Today we're taking a deep dive into Midi Health, a telehealth platform that's generating some buzz for its focus on women's midlife health.
Yeah, it's an area that often gets overlooked in traditional healthcare settings. It really does.
Definitely.
Midi specifically caters to the needs of women going through perimenopause and menopause. And what's really interesting is how they're approaching it from a holistic perspective.
Oh, okay.
Instead of just treating individual symptoms, they're looking at the whole picture.
Okay, so let's unpack this. What kinds of things are we talking about here? What does Midi actually treat?
Well, they address a wide range of concerns that can come up during this stage of life. We're talking about things like weight changes, sexual wellness, mood and memory issues, hair and skin changes, sleep problems, even care for cancer survivors.
Wow. That's a pretty comprehensive approach.
Yeah.
But is it really accessible? I mean, specialized care can often be expensive and difficult to find.
Yeah, that's true. That's where Midi really stands out. They're available in all 50 states. And they accept major insurance plans, which is a huge step towards making this kind of care more affordable and convenient for women.
That makes sense. So who are the clinicians behind Midi? What are their qualifications?
They're all experts with extensive training in women's midlife health. But what struck me is that their philosophy goes beyond just prescribing medication. They really prioritize listening to their patients' concerns and creating personalized care plans that address those specific needs.
So it's not just about treating symptoms. It's about understanding the individual woman and what she's going through.
Exactly. And that seems to be resonating with patients. I was reading some testimonials, and the common thread is that women feel heard and understood by their Midi clinicians in a way they haven't experienced before.
That's really powerful. Can you give us an example?
Sure. One patient named Laura shared that she had been struggling with weight gain and high cholesterol. Her Midi clinician worked with her on a plan that included GLP-1 medication, which is a class of drugs that can help regulate blood sugar and promote weight loss, along with lifestyle modifications.
Interesting. So they're combining medication with lifestyle changes for a more comprehensive approach.
Exactly. And for Laura, it made a huge difference. She lost 20 pounds and saw significant improvements in her blood sugar and cholesterol levels. But what's even more remarkable is how it impacted her emotionally. She felt empowered to take control of her health and said she felt like a new person.
That's fantastic. It sounds like Midi is really making a difference in these women's lives. But is it just a one-off success story, or are there others?
Oh, there are many more. Another patient, Victoria, was dealing with severe hot flashes and a racing heart that were affecting her sleep and her ability to work. Her Midi clinician prescribed estrogen patches, and within a few days, she experienced significant relief.
It's amazing how these hormonal changes can have such a profound impact on a woman's quality of life.
Absolutely. And what's interesting is that Victoria was able to get a same-day appointment, and her insurance covered the cost, which can be a rarity in healthcare these days.
You're telling me. It seems like Midi is really trying to remove those barriers to access.
They are, and they're doing it with a focus on personalized care and patient empowerment, which is really refreshing to see.
Yeah, it really is.
And it's not just the physical symptoms. They also recognize the emotional challenges that often accompany these hormonal shifts.
Yeah, you're right. Mood swings, anxiety, low energy, those things can really impact a woman's overall well-being.
Exactly. And Midi's clinicians seem to be very attuned to that. They're providing support and guidance to help women navigate this transition with more confidence and resilience.
Do you have any examples of that? How are they approaching that emotional aspect?
Well, one patient named Glenda, she shared that she had been experiencing debilitating hot flashes and heart palpitations, that were making it impossible for her to sleep or concentrate at work. But beyond the physical symptoms, she was also feeling incredibly anxious and overwhelmed by it all. Her Midi clinician not only addressed the physical symptoms with estrogen patches, but also provided counseling and support to help her manage the emotional toll it was taking.
That's really important. It's a reminder that menopause is not just a physical process, it's an emotional one as well.
Absolutely. And it seems like Midi's approach is really resonating with women who have felt dismissed or misunderstood by traditional healthcare providers in the past.
Can you elaborate on that? What are some of the specific things that Midi is doing differently?
Well, for one, they're really taking the time to listen to their patients. Several women mentioned that they finally felt like someone was truly hearing their concerns and not rushing them through the appointment.
That's a big deal. Feeling heard and understood can be so validating, especially when you're going through something as challenging as menopause.
Exactly. And beyond just listening, Midi's clinicians are also taking a more comprehensive approach to diagnosis and treatment. They're not just prescribing medication based on symptoms. They're digging deeper to understand the underlying causes and tailoring treatment plans accordingly.
So they're looking at the whole person, not just the symptoms.
Precisely. And that includes considering lifestyle factors like nutrition, exercise, and stress management. They're empowering women to take control of their health in a holistic way.
It sounds like Midi is really shifting the paradigm when it comes to women's midlife health care.
They are. And the patient testimonials really speak for themselves. One woman named Cheryl shared that she had been dealing with hot flashes and vaginal dryness, but couldn't wait the 6 to 8 weeks her primary care physician recommended for an appointment. She turned to Midi and was able to get the immediate care she needed, including a personalized treatment plan that addressed her specific concerns.
It's incredible how accessible they're making this type of specialized care.
It is, and they're not just focused on individual patients either. Midi is also partnering with employers and health systems to make their services more widely available.
That's fantastic. It sounds like they're really committed to transforming healthcare for women in midlife.
They are, and they're doing it with a combination of cutting-edge technology, evidence-based medicine, and a genuine compassion for the women they serve.
What's fascinating is how they're integrating technology into their approach. Can you talk a little bit more about that?
Sure. Midi leverages telehealth technology to provide virtual consultations, making it easier for women to access care from the comfort of their own homes. They also have a user-friendly app that allows patients to schedule appointments, communicate with their clinicians, track their symptoms, and access educational resources.
It sounds like they're really streamlining the healthcare experience.
They are, and that's particularly valuable for women in midlife who are often juggling multiple responsibilities and may not have the time or energy to navigate the complexities of the traditional healthcare system.
You're right, convenience and accessibility are key. But what about the quality of care? Are they sacrificing quality for convenience?
Not at all. In fact, many women reported that the care they received through Midi was superior to what they had experienced in traditional settings. They appreciated the personalized attention, the holistic approach, and the fact that their clinicians were truly experts in women's midlife health.
That's impressive. It seems like they've really managed to strike a balance between convenience, accessibility, and quality.
Yeah.
It really does sound like Midi Health is addressing a crucial need in women's healthcare.
They really are. And it's not just about treating symptoms. It's about providing women with the knowledge, the support, and resources they need to navigate this transition with confidence and grace.
What I find particularly impressive is their commitment to making this kind of care accessible to as many women as possible. Their partnerships with employers and health systems are a testament to that.
Absolutely. They're not just treating individual patients, they're working to create a system-wide shift in how women's midlife health is approached and prioritized.
That's a powerful vision. And it seems like they're really making a difference.
Yeah.
The patient stories we've discussed today are incredibly inspiring.
They are, and they highlight the fact that Midi is not just a company, it's a community of women supporting each other, sharing their experiences, and finding solutions together.
It's amazing to think how far we've come in terms of recognizing and addressing the unique healthcare needs of women in midlife.
It is, and companies like Midi are leading the charge. They're breaking down barriers, challenging outdated assumptions, and empowering women to take control of their health and well-being.
Thanks for spending 10 minutes with us, and be sure to look for more 10-Minute Health Tech podcasts.
Bye.
Bye.